Okay, this next technique I want to demonstrate is called muscle testing. Some people call it applied kinesiology too, so that's another term. But with applied kinesiology, muscle testing, we're performing tests on the muscles to see what areas to treat then. So again, us as massage therapists or people that have just performed stretching, those kind of things, we cannot diagnose anything. We can just tell if a muscle a little bit more weak or if you're having problems in that area. So that's what we're doing, is we're testing those kind of things. So what we're going to do is have them bring their pinky and their pollicis, their thumb together, and you always want to make sure you do a neutral test first. So what you're going to do is you're going to try to separate that. When you try to separate it just a little bit, so you want to just separate the pinky and the pollicis just a little bit, and that's your neutral. So you always perform that first. The next one, what we're going to do is we're going to swipe a muscle. So we're going to, again, you're going to test that, a neutral one first. Relax, swipe it, and then do it again then. So again, when you swipe that muscle, it's stimulating the nerve endings and it's letting you know whether that area is weak or not. So after you do that, let's say that's weak, I'll treat that area, I'll do whatever I can to help stretch it out, to massage it, those kind of things. And then afterwards, what I'll do is I'll do a neutral test again, then swipe it, and then see if there's any kind of improvement then afterwards. So again, that's applied kinesiology kind of treatment then. So that's the most beneficial. You can do it on anywhere on the body, so you can even tell them certain areas too. So you can, like this, you see, let's say right shoulder. So you can see if there's weakness or not, or if there's an area that you need to concentrate on. You can go right shoulder or left shoulder, and it doesn't even have to be on the same side of the body either. So again, when you're just saying those kind of things, but sometimes if the person doesn't understand muscles, try not to use those kind of terms. Just use areas of the body. So the quicker you do this, the more accurate it is. So if you, let's say you perform this, and do a neutral test first, and then say right shoulder, then you wait for a little bit, and then they can think about it and they can actually resist better. So what you're going to do is you're going to do a neutral test real quick and do it really quick. So say right shoulder and then do the test right away and see if there's any difference. So again, the quicker the better. And again, this is not 100% accurate, but it's more accurate than just guessing in these kind of areas. Some people believe it's even 75% plus accurate for these kind of areas, but you just want to make sure you perform this many times before you really perform it on the public for those different areas, because it takes a while to really get used to the different kind of strength. So you want to make sure you use the different kind of strength each time you try to pull that area apart. And after a few times, their fingers will maybe get a little bit fatigued, so you can use different fingers also for these areas. So it doesn't have to be just those areas. And you can even use it with the arms too, so have them try to resist, try to flex kind of thing. So then you can swipe an area and sweat and see if there's any difference with that too. Okay, so that's applied kinesiology kind of technique. So again, we can't diagnose, but this is a way to try muscle area problems beforehand. So it works really beneficial. So it's something you can chart too, so you can document that. And sometimes when the client sees it, sometimes they're just in awe, but after a while they're just amazed at how accurate it is, and especially if they see improvement afterwards. If you perform it again when you're done treating that area and they notice improvement, they're more likely to come back to you when they're actually seeing those kind of improvements then. So again, applied kinesiology. Next one is called the Enfield Test. So with the Enfield Test, what we're going to do is it's like a bouncing kind of test. So you're going to bounce one side and bounce the other side. So this can be performed anywhere as the body. So you can perform here, even the sides, especially with the ankles, any joint regions. So with the quads, you can perform it too. But you're just going to kind of push one and push another one. And this is kind of hard to analyze, but the one that doesn't bounce back as good, that's why they call it an Enfield test. The one that doesn't bounce back as good, it's protecting a little bit more, so that's why you want it to kind of bounce back really good afterwards. So it's just a different way of testing out things, is called the Enfield test then. Another option is you can test out the fascia in the body too. And with that, you're going to just use your fingertips. You can just go up and down or different areas in the body, so see which way is more restrictive. And the area that's more restrictive, that's the area you want to stretch out more in those areas then. So again, more of a palpation kind of stretch for the fascia is what you're trying to do. So you're going to try to look at the flexibility. So you can compare one side to the next, even one quadrant to the next quadrant kind of thing. So there's different quadrants in the body, so you're just testing, let's say the shoulder area, then this area, so see which one is more resistive and which area you want to concentrate on more. So that concludes our form with muscle testing. So that's just different options you can incorporate into your treatment then. Thank you.